Well, we're here with Dr. Jackson, a dentist in Shreveport, Louisiana. Is that correct, Dr. Jackson?
That's correct.
Well, all right. Dr. Jackson, tell me, you're a dentist. Different dentists have a different type of practice, and even though a dentist is a dentist is a dentist, but it's not totally true. So tell us a little bit about your practice, your philosophy, what you aspire, what your clientele can look forward to in your practice, or not look forward to because you're not doing it. Give us a little background of your practice. Even why did you become a dentist?
Okay, well, I was like 14 years old when I decided to become a dentist, and I kept the goal at my forefront, and so that's what I became. I practiced in the Indian Health Service as well as the VA Medical Center and a private practice, and so now I've decided to open up my own practice. My practice is maybe 2.5 years old now, and I'm a general dentist. My population is varied. It's in an area where I am in the middle of different economic levels of patient population. I have patients that may be on the lower income, as well as patients that are higher income. I treat patients. My main goal is to educate a patient, to educate them on how to maintain and how to keep up what I've done or keep up what they're doing if it's correct. And so that's our main goal. And education is what I find lacks in a lot of other practices, because the patient usually comes and they've been to the dentist all of their lives, and I'm telling them things that they say they've never heard.
Interesting. Well, obviously, education is really why we don't do certain things. It's like if we're not educated in diet, and if you're not educated in what it does if we don't eat a certain diet, that's where we don't eat it. If a child isn't educated in why to wash their hands after playing outside in the dirt and before eating, he won't do it, because why should he? I mean, there's no reason to, and so with no doubt education in the dental office. Yes, we all get some education in school of why we're what, but not really. Because when it comes to real life and you have to put down a few $1,000s, that little school education goes right out the window.
That's right.
And I can definitely see that. I'm sure you're doing your patients a very, very great favor there. Well, all right. Thanks for letting me know. We're going to talk, quite a bit more about particular procedure, particular illnesses, particular, dental diseases people have and how it affects them. Basically, we're going to transform this type of education right here on videos and stuff, so that people actually can see it, that they can find out a little bit what you're all about. There's obviously no substitute for going to a dentist and getting it checked out, because otherwise that's called self-diagnosing, and especially in the mouth where you see nothing, that just doesn't work.
And the thing is, a lot of times, by the time you feel something or see something, it's gone way too far to where you need way more treatment than if you were to just keep your 6-month visit and get whatever care you need at that time in order to prevent having expensive treatment.
Right. Well, it's like with a heart attack. By the time you feel your chest cramping up, it's too late, right?
Right.
All right. Okay. Well, Dr. Jackson, thanks a lot. And speak to you more.
Okay. Thank you.